Like these young people, you should tour your hospital early in your pregnancy. When you have seen its facilities and systems, you will realize that most routines have been developed to serve a large number of people rather than you specifically. But the hospital staff providing your obstetrical care can personalize it for you, especially if you show you want to be involved and informed. Approach it like an aware consumer. If you're concerned about matters such as how long you might have to spend in the admission department or when your husband can be with you, ask somebody.
We all know atmosphere alone doesn't give rise to quality babies, but there are 7 practical advantages you should expect from any good urban hospital providing obstetrical care.
Your hospital will have a 24-hour anesthesiology service, a 24-hour on-site neonatal service, a 15-minute access to surgery if it's necessary, an on-site blood transfusion service, internal and external monitoring equipment such as fetal heart monitors, a 24-hour laboratory service, and a trained and experienced staff on hand for any emergency. Let's have a closer look and join a tour of hospital facilities with Nurse Rita Goodhooft and a prenatal class.
Well, welcome to York Central Hospital. What I'll be doing during the tour here is I'll just be giving you a little bit of an idea of what sort of things you can expect when you come in labor. I'll just maybe start from the very beginning when you first come in and go right through to the recovery room. I'm not sure.
These young people will be raising questions you should be prepared to ask when you visit the hospital. So have a pencil and paper handy to jot them down. For example, ask about the following labor room procedures. The intravenous hookup to provide nourishment during labor. Induction of labor, the artificial means of starting labor. The fetal heart monitor, which will track the baby's heart rate during contractions. Pelvic examinations to check the dilation of the cervix. Anesthetics or analgesics. What type of painkillers are available? Positions for laboring. There are several. Your husband's presence. When can he be allowed into the labor room? Alternative labor room procedures. Is there a birthing room or birthing chair?
Another thing I find it's handy for people to know, actually I'll tell you a little bit about the labor bed first. This is what we call our labor and delivery bed. This is the bed that you'll be laboring on, and you'll be delivering on the same bed, so you won't have to get off the bed onto the stretcher, and onto the stretcher, onto the table, and on the table back to the stretcher, and then into your own bed. Okay, you do all your work on this bed here, or in the chair of course, or walking around, whichever is comfortable. But this is our labor bed here. This will be your bed until then. The bed can be adjusted at the head here, and this is handy for the husbands to know. There's just a bar that you lift up at the back here, and then you just pull the bed up. Okay, you can sit right up straight if you want, if that's comfortable for you. It should. There it is. Okay, or you can have it flat, whatever's comfortable. Okay, our call bell is here. If you need a nurse for anything and she doesn't happen to be in the room at the time, just push the bell. Someone will speak to you through the wall here, and you just tell them what you want, and then someone will come in. Okay? Another thing I find is handy for the husbands to know too is there is generally a K basin, one of these little things, in the drawer. Throwing up during labor is actually very common. Don't let it upset you. Well, what can happen if you're upset? But this throwing up is very common, okay? And this basin is handy to know where it is because you may need it in a hurry. And if you can't find the basin, the garbage can is right there. But call a nurse if your wife is feeling nauseated. Call the nurse and we'll come in if we're not here. Okay? Usually with your first baby, we like you to push in the labor room until we see a fair bit of the baby's head, about that much of the baby's head. Actually, it's at the point where the baby's head comes down on the perineum and doesn't really slide back between contractions, okay? And at that point, we'll take you to the delivery room. But we like to keep you in the labor room as long as possible because it's a little cozier here, and we have the nice wallpaper and everything, and it's a little more pleasant here than down the... I mean, not to say the delivery room isn't pleasant, but it is nicer here, and there's really nothing happens anymore in the delivery room while you're pushing anyway, so this is why we keep you here.
At what point do you shave?
Oh, I forgot the shave, didn't I?
Yes, you did.
Oh, dear. Well, we do that before we give the enema.
Okay.
Okay?
All right.
Two assaults at once. No, with your shave is actually, we don't do much of a shave these days. It used to be that they used to shave everything, but now it's just a very minimal shave, and we just shave the perineum, that's all, okay? The perineum being the space between your vagina and your rectum. And that's really all we shave. Okay, that's just so that when the doctor, if an episiotomy is necessary, that, you know, the hair won't get in the way of the healing process.
An episiotomy is usually very necessary.
Well, some doctors do them, some don't. We just had a delivery and there was no episiotomy, and that was with your first baby.
I understood 99%.
Well, it is a high percentage,
yeah.
You're right, yeah. So
okay.
that's something that I think if you feel strongly against too, you should discuss with your doctor. If you would really like to do without.
That's bothering me about this.
We'll talk this over with your doctor.
Okay.
Okay? If you have any questions, the best person to discuss that with is your doctor before you come in. Okay?
Well, I plan to next week.
Sure. Okay? Well,
In the
this is a
delivery room, ask about the following.
You see the difference here, of course.
Your husband's presence here. When can he enter? And how can he be involved? Positions for delivery. The most common is at a 45-degree angle.
On your bed here, we'll park you right here.
Use of an antiseptic. Is it necessary? Episiotomy, a vertical incision to prevent tearing. Is it automatically performed? Use of forceps. Why would they be necessary? Are there alternative delivery procedures, like the gentle environment of the Laboyer method, the birthing chair, or water immersion? What are the postpartum or after-birth procedures for you and your baby?
We don't bind you into these things. It's just to support your legs. Then we're going to attach the suction tubing to the side of the bed here. The suction tubing is for the doctor to suction out the mucus of the baby's mouth. We weigh the babies down here. Everything else is done in the nursery. As far as bathing and measuring of the baby's head and that sort of thing, and the length of the baby, it's all done in the nursery. We just weigh the babies here. And we put their first pair of Pampers on them, little tiny ones, and we'll wrap the baby up. And then the mother receives the baby again. Okay? During that time, of course, the father should sit in his chair, which will be placed right next to his wife's head. And he, of course, can stand up and see the baby being delivered up over the drape and everything, but he shouldn't be touching anything either, okay? Unless the nurse says, of course, come on over here and do this or do that or whatever. And if at any time, of course, the father feels like he wants to leave the room, then he's welcome to do so, too, before he doesn't know where he is anymore. Okay? But don't worry, not many of our fathers faint, so don't worry about it. Okay? Any questions?
What's the hospital's policy on the father being present during a C-section?
Well, it depends usually on why the cesarean section is being done. Of course, this being your first baby for most of you, we don't know if you're going to be having a cesarean section, and you know, you may not know that. If it's a real emergency, like it needs to be done very, very quickly, then I would tend to think that the doctors will not allow the husbands to come in. But if it's going to be done for, say, for instance, that you're not progressing or the wife is not progressing and she's not making any progress in labor, that sort of thing, then generally the husbands are allowed to come in. It just depends on the circumstances, but generally the husbands are allowed to come in for a cesarean section.
And can breastfeeding be done in the delivery room, or do you?
Well, it can be, but usually we're only in here for such a short period of time anyway that, you know, once the baby's been delivered and once, if the doctor needs to make an episiotomy, he'll stitch you up, of course, and that's done here. And then we put your legs down again and we go off to the recovery room and you can nurse right away in there. Okay? I mean, you can start here, but usually it's a bit awkward with your legs up in stirrups and, you know, with all the green sheets and everything all over. Yeah, you're only in here for a very short period of time. Okay, just long enough to deliver the baby and to, you know, be sutured, and then to take you to bed. Then we take you to the recovery room.
As you're getting comfortable in your hospital room, your baby will be taken here to the nursery to be bathed.